Hi, my name is Prableen, and today we'll be learning about the universal healthcare in Canada from the years of 1950 to 1982. Canada's universal publicly funded healthcare program provides residents with relatively equitable access to healthcare resources. This program is termed Canada's National Health Insurance Program, also called Medicare. But what exactly is the purpose of this program? Well, this program was designed to make sure that all residents of Canada sustain medical care and hospital treatment when needed, not on the basis of their ability to pay. Therefore, it defines their national value. Considering there are millions of people on this planet, Medicare can be moderately expensive. The expense for this program is funded through general taxes or compulsory health insurance premiums. Now, Medicare has developed in two stages. The first stage was the Hospital Insurance and Diagnostic Act of 1957, which gave the Canadian government authority to enter into an agreement with the provinces to establish a comprehensive universal plan which covers acute hospital care, laboratory, radiology, and diagnostic services. The extended health insurance to cover doctor services by Medicare Act of 1966 was in effect 9 years later. So who started the universal healthcare in Canada, and why did this person do so? The Premier of Saskatchewan, 1994, and the first leader of the National Democratic Party led the first socialist government elected in Canada. Also recognized as the father of socialized medicine of Canada was Thomas Clement Douglas, also known as Tommy Douglas. He was born on October 20th, 1904 in Falkirk, Scotland, and died on 24th February 1986 in Ottawa, Ontario. At the age of 6 years old, Tommy had injured his knee cutting it on a stone and later developed osteomyelitis, an infection of the bone, causing him to spend a larger amount of time in hospital. Although after many operations, his leg would have had to be amputated, but a well-known orthopedic surgeon, Dr. R.J. Smith, took interest in Tommy's case and offered to help him if medical students were allowed to observe. Fortunately, the operation was a success, and this has inspired Douglas's later belief that quality medical care should be available to all Canadians regardless of wealth or status. Alongside his infection, he had remembered being a 14-year-old girl who died of a ruptured appendix and periodontitis, and buried two young men in their 30s because there was no doctor available to care for them and because they didn't have enough money to get the proper care. One of the most significant innovations during his time as Premier of Saskatchewan was the implementation of government-funded health insurance. In 1947, the Saskatchewan Hospital Services Plan came into effect, providing the first hospital insurance plan in Canada, and by 1954, about 810,000 people in Saskatchewan were covered by the plan. This prompted the federal government to create a national plan that helped fund diagnostic services and hospital operation costs in conjunction with the provinces. However, Douglas's government was determined to provide a system of full health insurance to the people of Saskatchewan. In October 1961, the government introduced the Saskatchewan Medical Care Insurance Act that was passed and given a royal assent in November 1961. Although Douglas had played a lead role in developing and prompting the act, he resigned as premier only a few days before the bill became law. He was then nominated as the new leader of the New Democratic Party, also known as NDP. As we live in an advanced modern era, technology plays a significant role in our daily lives, but how does it contribute to the medical technology? One of the most important aspects of healthcare delivery is to store, share, and analyze health information which can be used, for instance, to ensure continuity of care and research purposes. In the late 1970s, mini computers began to become more available and being widely used in the healthcare mainly for the administrative purposes. This involved hospital billing, financial applications, and physician billing. For the first 10 years, healthcare automation was quite limited as most vendors focused on limited family member applications, and almost every system was designed for a single hospital or physician practice. In the early 90s, the industry began to see the integrated systems. Until the mid-1990s, minimal work was being done on integrating computers into the clinical process. Although the industry saw the automation of order entry, innovation automation of the clinical process was still lacking the four primary reasons. The first was just to see the extended use of clinical data with large databases available for advanced application. The second was until the mid-90s, the most vendors perceived no need to develop advanced options while there was still marketing opportunities. The third was that there was lack of supportive data to show the advanced clinical applications while there were still no market opportunities. The last was unrealizable growth expectations by stock analysis resulting in very few vendor funds to development of the new systems. In the present time, technology has developed significantly from the 1900s. For instance, we have new machines to detect internal injuries like CT scans, MRIs, ultrasounds, angiograms, etc. We also have ambulances secured with medical equipment. Physicians and hospitals have a more developed database for documentation, communication, keeping and transferring healthcare records for the continuum of care, etc. In the future, scientists are trying to create more technology to perform surgery with the use of robotic equipment, genome mapping, etc. Now, given the fact that healthcare has advanced substantially, it was only this developed because of the prior research and history behind it, times we are currently in now. Thank you for listening, and if you have any questions, please don't hesitate to ask.